Hi, my name is Carmen, and I am an early childhood special education teacher, a life and ADHD coach, and I'm the host of this podcast, Authentically ADHD. I created this podcast to help anyone wondering if they have ADHD, people who have been diagnosed for a while and want some more support and community. I'm here to bring you the latest research on ADHD and neurodiversities while we talk about the good, the bad, and the ugly of ADHD. Are you ready? Let's get started. Hi there, and welcome back to Authentically ADHD. With me, Carmen. This is the podcast where we explore the many layers of living with ADHD and the ways that we can thrive in a world that isn't always built with us in mind. I'm your host, Carmen Irace, and whether you're newly diagnosed, wondering if ADHD is a fit for what you're experiencing, or just here to understand yourself a little bit better, I am so grateful you pressed play on this podcast. Before we get started, I just want to remind you that we have ADHD. Our working memory sucks. So if you enjoy this podcast, please quickly scroll up to the top and hit the follow button. That way, my episodes will pop up every time there is a new one. And if you go on YouTube, I am not fancy, all right? I made an overlay in Canva, and that's the video. They're really just audios that are on YouTube for accessibility, for people that don't have podcast apps. So if that's an easier way for you to listen, they are over there as well. It's not high quality video. I'm going to repeat, there are a few video episodes, and but mostly it's all audio. But I'm just so glad that you clicked play on this podcast, because there are so many for you to choose from. And today, the topic I want to dive into is one I have been looking forward to, because I've been asked questions about this a lot, and it's all about the process of getting diagnosed with ADHD, the treatment options that are available that you can take or that you can have, and then I want to give you just some essential tips to help you navigate this journey, because it can feel lonely. It can feel scary. It can feel very unknown, and like people are judging you. But I do this podcast to spread awareness so that people go and get evaluations so that they get their diagnosis correct. This podcast could lead you to think and to feel like you don't have ADHD, but it also could help you to move forward just with getting a diagnosis. And I'm going to be sharing 5 actionable tips to support you or someone you know or love along the way, including a closer look at the role of coaching, medication, and some other key supports that I have found useful. So, are you ready? Let's get started. Speaking of extra supports, I just wanted to tell you all that I've updated my Patreon page to include all of the resources that I've really ever made to be held in one place. Just head to my show notes. The VIP members do get a little extra, but you can also purchase like my brand new Ultimate ADHD Journal and Planner, which I've been using for the past year. That has worked. Nothing is priced over $10, and everything is at least 50 to 100 pages that you can download and print. You can get it to bind it and send it to you, or you can just read it off your screen and use notebook paper. So if you want or need any type of that kind of extra support, just head to my show notes and click the Patreon link to join. I hope to see you in there. Hi there, friend. Just your friend Carmen here to remind you, or just to inform you, that a lot of the information and tips that I give do come from my membership and what I learn in my group coaching program, Focused, by Kristen Carter of the I Have ADHD podcast. If you use the link in my show notes, we both save money. Because, I mean, who doesn't need to save money, especially when we're trying to help ourselves? It's helped me improve in so many ways. So if you can afford it, go check it out and check out her free content because it is amazing. All right, back to the show. All right, so let's kick things off with the diagnostic process. Getting an ADHD diagnosis can feel like a really big, monumental step, especially if you've been living with symptoms for a long time and you haven't gotten diagnosed until adulthood. I say this from experience. So first, it's really important to know that ADHD can be diagnosed at any age, though the process might look different, like for children compared to adults. So, as it goes, and if you have ADHD and you're trying to figure out how to get diagnosed, I know the feeling of where do you even start? So there are actually a few routes that you can take. There are, the route that many people take is beginning with their primary care provider or pediatrician if you're a child, who can then refer you to a specialist. Here's where I'm going to give a disclaimer. Not all primary care providers will refer you to a specialist. They will attempt to treat ADHD on its own. Now, while this might work for some people, I am not going to badmouth or talk down about any type of diagnosis here. I'm good with all the types of diagnosis, but personally, from my experience, which I did go through this, many people begin this way, going through with their primary care provider. My primary care provider was also trying to treat my ADHD and my comorbidity, anxiety, and seasonal affective disorder, and sometimes situational depression. With that type of a diagnosis and comorbidities, it's really, really smart to be seeing a psychiatrist or a nurse practitioner who's under a psychiatrist and getting the full diagnosis by a psychologist. That is another route that you can go, which is seeking out a psychologist, a psychiatrist, or even a licensed clinical social worker with experience in ADHD. It's essential to find someone that is knowledgeable about ADHD specifically, as it can be misdiagnosed or misunderstood by those that are less familiar with it. Let me explain. I did seek out a psychologist at some point, and I got my diagnosis of ADHD inattentive type, depression, and generalized anxiety disorder. Then I did a little stint in an inpatient hospital where they stripped me of all of the medication I was on, and they observe you and they take your vitals like every 4 to 6 hours. I don't know what it was. It was a lot. They would wake you up in the middle of the night, early in the morning, all the things. They had me on like slight anxiety medication, and they observe you. So they are able to diagnose you more accurately the longer you're in there. And I was in there from anywhere from 5 to 7 days. It's a little hazy because the beginning is a little hazy. But they observed me, and on my exit, they told me that my actual diagnosis was ADHD combined type presentation, that I was probably on the spectrum of autism, but they did not put that on my paperwork because it's not significant enough. It doesn't affect my job or my life enough at this point to get to do anything much about it besides be aware of it. And I don't have depression. They said I get situational depression, and I was in there during winter. I have seasonal affective disorder. For me, that means the seasons don't make me, like when it's winter and cold and dark, it doesn't necessarily make me depressed, but it pulls on my ADHD symptoms. It makes me more inattentive. It makes me more tired. It pulls on the inattentive type of because I'm combination, I present differently all the time. I present with hyperactive and inattentive types. So, the whole, and also, they said that I have generalized anxiety disorder with, panic. And that's just one little story about how even a psychologist, going through a whole test, you can get the right diagnosis, but it still can be off. Knowing I was combined type and not inattentive type really helped me, because things that help people that are just inattentive don't necessarily help people who have a combined type presentation. Now, if you want to know more about the 3 types, I am going to talk about it a little bit here in a minute, but I do have other episodes that are all about the types of ADHD and how it presents differently. And I say this often, if you've met one person with ADHD, you've only met one person with ADHD. It does not look the same across the board. Actually, I've never met 2 people who have the same ADHD, or it looks the same. Just like autism, it's a spectrum. So, the evaluation itself usually includes a combination of interviews, little questionnaires that you fill out, and there should be some type of either computer-based test, or I remember doing a block little exercise, looking at cards and telling them what I thought I saw. There are lots of different avenues that a psychologist can go down. They will also ask for a history and childhood behaviors as you can remember them, and they will ask how ADHD symptoms show up in your day-to-day life and how it impacts day-to-day life now. So for children, input from parents, teachers, and other caregivers often play a big role. For a quick tip for adults, bring a specific list of specific symptoms and examples from your life to your assessment. Also, if you can, try to find some old report cards and stuff. That really helped with mine because it said a lot of things on there, like talks a lot, doesn't work up to potential, needs to pay attention more. These things can help the clinicians get a full picture, and it helps avoid those common misdiagnoses, especially in adult women, where symptoms can sometimes be mistaken for anxiety or mood disorders, and you don't want that. Okay, so say you've been diagnosed. Now what? Because again, now you've been diagnosed, so you do have ADHD, and it's a really big now what, because there are a lot of options, and I'm going to break it down for you, all right? When it comes to treatment, there's no one-size-fits-all approach for ADHD. The goal is to help us manage the symptoms so you can live a full, balanced life to the best of your capacity. Treatment options usually fall into a few key areas: medication, behavioral therapy, coaching, other therapy, and lifestyle modifications. The other type of therapy that I'm talking about that's not behavioral therapy is therapy that is trauma-based and EMDR therapy. I do suggest this if you are an adult that has been diagnosed with ADHD and you feel that you may have some trauma in your childhood. I would suggest that as a coach. So let's talk about the behavioral therapy. So like therapy, especially cognitive behavioral therapy, is a really powerful tool for people, kids, and adults managing ADHD. CBT therapy can help you build strategies for dealing with challenges like time management or emotional regulation. This is a practice that's used a lot with children, and it's used before the kids are put on medication, unless the symptoms of the ADHD are inhibiting the child's growth. Then medication is usually thought of before therapy, or they go in conjunction with each other. I would suggest starting with therapy, and if you feel you need medication, going from there. But if it's significantly impacting your life, try medication, small doses. There are tons of different ones. They just came out with a bunch of new ones, and there's all different ways. They come in liquid, tablet, extended release. There's even a patch now. So anyways, I'm getting sidetracked because I'm still talking about therapy, but it's one big hang up for me that a lot of people don't want their kids diagnosed with ADHD because they feel they're just going to be medicated. But usually the first approach is therapy, because it can also address any other coexisting conditions like anxiety or depression, which are common among people with ADHD. So for many people, medication can also make a significant difference. There are two main types of ADHD medications, stimulants and non-stimulants. I know people who are on stimulants, I know people who are on non-stimulants, and I know people who don't take medication who are successful. So, I just want to say that before I got started. Stimulants are the most commonly prescribed, and they work by boosting certain chemicals in the brain that help with focus, impulse control, and all the executive functions that we have. Okay? So they level the playing field of our brain each day to where our neurotypical peers would be. For non-stimulants, they're a great alternative for people who don't respond well to stimulants, have bad side effects from them, or have really, really high anxiety. Now, finding the right medication and dosage often involves a bit of trial and error. And with stimulant medications, it can be a little bit faster because it doesn't take a long time for them to, they don't need to build up in your system. They work the first day that you take them. I mean, they either work or they don't work, really, usually. Non-stimulants take a little bit of time. But with a good doctor guiding you, it can be worth the journey. I speak from experience and from clientele experience. I mean, there's off-label ways to treat medication or treat ADHD with medication as well. So just keep all that in mind. The other treatment option that I want to talk about is coaching. I can't go without mentioning coaching because I am an ADHD coach, and I'm also in an ADHD coaching program. Just like therapists need therapists, coaches need coaches. And coaching can provide a personalized support and accountability, helping you set realistic goals to build sustainable habits and maintain your motivation. ADHD coaches understand the unique way that ADHD affects daily life, and it can be invaluable in creating a plan tailored just for you. I joined an ADHD group coaching community to add in that community aspect that we crave so much. Now, there are other things that you can do that fall under lifestyle changes, things like exercise, diet, sleep habits. Those can all play a big role too, but that is a little overwhelming when you first get diagnosed. The way my coach puts it, you want to kind of triage, right? When you get diagnosed, you pay attention to the most important thing first and go from there. So doing physical activity to boost dopamine levels naturally can be something that you start whenever, but establishing routines and structures may take a little while to do. And you might have hectic days until you're able to get a hold of the ADHD and establish routines that benefit you. All right, are you ready for the 5 essential tips for navigating ADHD? Now that we've covered the basics, let's dive in. Tip number 1, educate yourself and advocate. The first tip is to educate yourself about your ADHD. The more you understand how ADHD affects your brain and behavior, the easier it becomes to advocate for your needs, make accommodations, and support yourself, whether that's in the workplace, at school, or even at home. Don't be afraid to dive into reputable books, articles, and of course, podcasts like this one and others. Knowledge is power. I love the I Have ADHD podcast, We're Busy Being Awesome, or I'm Busy Being Awesome, and some other ones. Haley Honeyman is a good one on YouTube, and so is Jessica McCabe for the How to ADHD. And then I love the ADHD Love couple as well, and they have 2 books that they wrote as a couple. Tip number 2 is build a support network. Having a network of supportive people makes a huge difference. This could include friends, family members, or even a therapist or coach who understands ADHD. Support groups, both online and in person, can be great places to connect with others who truly get it. Take it for my word for it. Like, ask me how I know. I love my community focused. And if you want to check it out, use my link in the description. We both save money, and that's awesome. So consider working with a coach one-on-one or in a group. ADHD coaches can help you make concrete changes to improve your daily life. Unlike therapy, which often focuses on processing emotions, coaching is action-oriented. Together, you can set goals, build skills, and track your progress. It's kind of like having a personal trainer for your mind. Number 4, experiment with tools and systems. Every ADHD brain is different, so finding tools that work best for you is key. You might try using a planner, setting reminders on your phone, or using apps designed for ADHD time management. Be willing to try different systems until you find the one that feels manageable and most effective for you. And tip number 5 is remember, self-compassion is essential. My last tip, and this one might be the very most important, actually it is the most important, is to practice self-compassion. ADHD can make everyday life just a bit more complicated, if not a ton more complicated, and it's easy to get frustrated with yourself. Remember, this is a journey, and there will be ups and downs and ebbs and flows. Try to celebrate the wins and give yourself grace on the tougher days. You're doing the best you can, and we're given directions in Japanese written backwards while everybody else has them in English. All right, my friends, that brings us to the end of today's episode. We covered a lot, from the ins and outs of diagnosis to treatment options, and even some top tips for thriving with ADHD. I hope you found this episode helpful, and I hope that it answered some questions that you might have had about this process. If you enjoyed this episode, please take a moment to rate and review on your favorite podcast platform. It gets us pushed out to other people so you can help me help as many people with ADHD as possible. Don't forget to hit that follow button so you don't miss out on any future episodes. I'm so grateful to have you all here growing and learning with me together. Remember, you're not alone on this journey. There's a whole community out here cheering you on. That's all I have for now. We will talk soon.